Good afternoon, all of you. I'm so happy to be here, so proud to be here to represent Apollo Hospitals and talk about health for all. I have a small presentation here so that you can see some numbers and achievement here. The numbers shown on the first slide. Tamil Nadu has allocated more than 22,000 crores in the current budget, and 6.5 lakh people are visiting Tamil Nadu for availing healthcare from India and also from abroad. And Tamil Nadu stands at number 1 in medical tourism vertical. These numbers are not easy to achieve. We are able to achieve in the last 5 decades, not by accident. It's because of thinking, creating a system where we are able to achieve it. There are persistent effort, persistent transformation. So many things have happened in the last 50 years. I'm here to talk about how the journey has happened and what lies ahead in front of us. So where we have started, until 1970s, nothing much has happened. I want to give you a snapshot of what was the situation of Tamil Nadu healthcare status in the year of 1970. Look at the infant mortality rate. 116 infants died out of 1,000 live births. That was the status just 50 years ago. The life expectancy at birth was 48 years. We used to have only 0.3 hospital beds per 1,000 population, which is much below the WHO requirement. And we used to have only 9,200 doctors for 41 million people. That was the status in 1970. That looks so sad. I have a small video here. It's a 3 minutes video. It's slightly lengthy. By looking at the video, we can clearly see how we have transformed healthcare system in Tamil Nadu. I request all of you to watch a bit patiently, because that one video will tell you what is really happening in our state.
என் பேர் வந்து சங்கீதா. நாங்கள் வந்து மதுகூர். கணவர் பேர் வந்து பிரகாஷ். எனக்கு அவர் ஹேண்டிகேப்டரு. எனக்கு வந்து 2 பசங்க. பையன் 11th படிக்கிறான். பாப்பா பொன் பாப்பா 26 6ஆம் மாதம் 2013 பாப்பா பிறந்தா. பிறந்து 42 நாள் குழந்தை வரைக்கும் கிளியராக இருந்தா. எந்த ஒரு பிரச்சனையும் இல்லை. ஒரு நாள் வந்து ஒரு கை ஒரு கால் ஃபிக்ஸ் மாதிரி வந்து அப்படியே இழுத்துக்குச்சு. அங்கே கிராமத்தில் இருந்ததுனால அது எங்களுக்கு தெரியல. இது ஃபிக்ஸுங்க, இங்கே யாராலையுமே ஒன்றும் பண்ண முடியாது. எக்மோரில் அட்மிட் பண்ணோம். பித்தப்பை ரிமூவ் பண்ணணும்னு கேட்டாங்க எங்கள் கிட்ட. சரி பண்ணிடுங்க, அப்படி பண்ணால் மட்டும்தான் குழந்தைய காப்பாற்ற முடியும்னு சொன்னாங்க. சரி பண்ணிடுங்கன்னு சொன்னேன். அதோட சரின்னு சொல்லிட்டு குழந்தைய எங்ககிட்ட கொடுக்கும்போது அப்படியே ஃபுல்லாகவே எல்லோ கலரில் இருந்தான் அந்த குழந்தை. முடிச்ச பின்னால் அதுக்கப்புறம் ஒரு 10 days கழிச்சு சரி குழந்தைய கூப்பிட்டு போயிடலாம், நல்லா இருக்கா நரம்பா இருக்கா அப்படின்னு சொன்னாங்க. இதுக்கு மேல்பட்டு எந்த பிரச்சனையும் வராது, பத்திரமா பார்த்துக்கலாம் அப்படின்னு சொன்னாங்க. நாங்களும் வீட்டுக்கு கூப்பிட்டு வந்து அதுலேருந்து நல்லாவே இருந்தா, எந்த ஒரு ப்ராப்ளமும் இல்லாமல் இருந்தது. நல்லா இருந்தால் நாங்களும் ஸ்கூலில் சேர்த்தோம். 4th standard போனால், அம்மா எனக்கு கொஞ்சம் லேசாக அரிப்பு தெரியுது அப்படின்னு சொன்னான். சீப் எடுத்து வச்சு அவளுக்கு எங்கெங்கே கீரணுமோ ஃபுல்லாகவே கீருவான். அவள் கீரி ஃபுல்லாகவே அப்படியே பிளாக். அவள் எங்கெங்கே கீரலோ மொத்தமே உடம்பு ஃபுல்லாக பிளாக். அந்த கண்ணு கூட அப்படியே அந்த எல்லோ கலர் இருக்கும், அந்த ஒயிட்னஸ் தெரியாது. ஒரு டைம் கத்தி எடுத்து அந்த பக்கம் விட்டு கீறான். அந்த மாதிரி எல்லாம் பண்ணான். ஒரு நாள் நல்லாவே தூங்கிட்டு இருந்தா எழுந்தா, அம்மா எனக்கு தலை சுத்துற மாதிரி. என்னம்மா அப்படின்னா, சரி தூங்கணுச்சே பாப்பா, அந்த தூக்கத்துல ஏதோ சொல்லுது போல பார்த்தா எழுந்து கொஞ்சம் தலை கொடுக்கல, ரத்தமா வாமிட். எனக்கு அப்படியே ஒரு நிமிஷம் ஷாக் ஆயிடுச்சு. நாங்கள் அவங்க மேமு கேட்டோம். இல்லைங்க, இது ஃபுல் ஸ்டேஜ் லிவர் கெட்டுருச்சு, அரிப்பு அதிகமாக இருக்கிறதுக்கு காரணமே இதுதான், இது லிவர் டிரான்ஸ்பிளான்ட் பண்ணி தான் தீரணும். நான் ஒரு ஹாஸ்பிட்டலுக்கு சொல்கிறேன், நீங்கள் போகிறீங்களாம்மான்னு கேட்டேன். சொல்லுங்க மேடம், நான் போகிறேன். டாக்டர் பேர் IIankumaran. அவர் நீங்கள் போனீங்கன்னா அவர் பார்த்துப்பாரு. நீங்கள் என்னென்ன என்கிட்ட சொன்னீங்களோ அதெல்லாம் அவர்கிட்ட சொல்லுங்க அப்படின்னு சொன்னார். உங்களை அப்போலோக்கே வர சொல்லிட்டாரு, நீங்கள் அங்கே போகலான்னு சொன்னேன். நீங்கள் பேரண்ட்டு லிவர் கொடுக்க ரெடியாக இருக்கீங்களான்னு. நான் கொடுக்குறேன் சார் அப்படின்னு சொன்னேன். சிஎம் ஸ்கீம் மூலயமா அவர் எல்லாமே எங்களுக்கு அலோவ் பண்ணியிருக்காரு, எல்லாமே பண்ணாரு. அந்த சிஎம் ஸ்கீமில் தான் எங்களுக்கு இவ்வளோ நாள் ஆகும், இன்னைக்கு வரைக்கும் பண்ணிட்டு இருக்குது. அதில் தான் பண்ணிட்டு இருக்காரு. இப்போ பாப்பாவுக்கு மெடிசன் ஆகட்டும்,
டெஸ்ட் ஆகட்டும் எல்லாமே அவங்க சிஎன் ஸ்கீம் மூலிமா தான் எல்லாமே தான் பண்ணிட்டு இருக்காங்க. இதை எடுத்து செய்யறதுக்கு கூட ஒரு இது வேணும் இல்லைங்களா?
ரொம்ப அந்த ஹாஸ்பிட்டலில் வந்து நான் ரொம்ப பயந்தேன். இன்றைக்கி அந்த ஹாஸ்பிட்டலில் உள்ள நான் ஒரு குடும்பமாக இருக்குது. அதுதான் எனக்கு ரொம்ப சந்தோஷம். இன்னைக்கு வரைக்கும் பார்ப்பேன் நல்லபடியாக மாத்திரை வாங்குறவங்களுக்கு எல்லாமே நல்லா இருக்காங்க. இன்றைக்கி ரொம்ப சந்தோஷமாக இருக்குது இந்த குடும்பம்னா அது சார் ஒரு காரணம். இந்த சர்ஜரிக்கு அப்புறம் இப்போ என்னன்னா அந்த அம்மா எல்லா வேலையுமே ஆக்டிவாக பண்ணுறாங்க. ஸ்கூலுக்கு போகிறாங்க, பசங்க கூட விளையாடுறது, எல்லா சேட்டையும் பண்ணுறது எல்லாமே ரொம்ப ஒரு நார்மலாக எப்படி இருப்பாங்களோ குழந்தைங்க, இங்கே ரொம்ப ஹாப்பியாக நல்லா இருக்காங்க. ரொம்ப சந்தோஷம். இளன் சாருக்கும் ரொம்ப நன்றி சொல்லணும். நான் வாழ்நாள் ஃபுல்லாக அதை மறக்கவே முடியாது.
This one story tells us where do we stand now. Do you all agree with me? Yeah, a small child from a village with a low socio-economic group, able to get the highest possible treatment. That's a liver transplant. It's a very expensive surgery which needs the highest possible clinical talent in India's biggest private hospital, which is funded by the government. That's a beautiful story. That's why we are here today. That's the effort has been put in by the government of Tamil Nadu, private healthcare people, and the clinical teams, the whole framework in the state. So where do we stand now? Look at the numbers. In 50 years, infant mortality rate has dropped from 116 to 13. It's further down now. It's nearly 8 right now. Look at the life expectancy. It was 48 in 1970. Now it's a 74. Maternal mortality rate, it's a 54. National average is still 97. Look at the number of hospital beds. We have 2.1 beds per 1,000 population. National average is just 1.4. Doctor-patient ratio, it's 1 for 495 people. National average is 1 for 834. Look at the budget allocation in the Tamil Nadu budget. It's 8.1% of GDP. Look at the national average, it's 5.9. In healthcare, there is no doubt about that Tamil Nadu is leading the country. We haven't developed or put the platform healthcare only for the last 50 years. Even there are a lot of literatures out there written more than 2,000 years ago. Siddha, I don't come from Siddha background, but I come from allopathic background. But a big appreciation goes to our ancestor for developing such a beautiful healthcare ecosystem 2,000 years ago. We can quote, I want to quote some poems from the past. Tirumular said, Udambar aliyil uyirar alivar, Tirambada மெய்ஞான சேரவு மாற்றார், உடம்பை வளர்க்கும் உபாயம் அறிந்தே, உடம்பை வளர்த்தேன் உயிர் வளர்த்தேனே. This is how they have given so much of importance to the body. Even they have advised 2,000 years ago, if you look after your body, your life will be perfectly fine. Even Thiruvalluvar said, மருந்தன வேண்டாவாம் யாக்கைக்கு அருந்தியது அற்றது போற்றி உணின். If you are able to eat after you digest your fast food, your health will be perfectly fine. The same thing we are talking after 2,000 years. We are talking about preventive health. Eat less, you live healthy. That's the kind of concept we are talking about. This is the quote from our chairman, Dr. Pratap C. Reddy, who is the founder of a private healthcare ecosystem. He's the father of private healthcare ecosystem in our country, founder of Apollo Hospitals. He normally says, Tamil Nadu did not just build hospitals, we built hope. To secure a healthy and prosperous future, India must urgently embrace a preventive healthcare mindset, one that can heal before there is a need to heal. Beautifully said. So I want to talk about 50 years of state-led transformation. Look at the beautiful framework done to develop Tamil Nadu's healthcare architecture. In 1975, PHC expansion was done. In 1994, Tamil Nadu Health System Projects was developed. 2011, CM scheme, Tamil Nadu CM Health Insurance Scheme was launched. And in 1983, Apollo has started India's first private hospital in Chennai, Grims Road. Kalaignar Insurance Scheme was launched in 2003. In 2021, Tamil Nadu has launched a medtech zone in Chengalpet, and now in 2025 budget, Tamil Nadu has allocated more than 21,000 crores for healthcare. Not only caring for the people, Tamil Nadu has also thought well about creating the talent to provide highest possible quality of care. Look at Madras Medical College. Asia's first medical college was started in 1835 in Madras. Many other hospitals have been started after that. Stanley, followed by Key Park Medical College. There are many private institutions like Sri Ramachandra Medical Colleges. There are 75 medical colleges, almost 1 or 2 medical colleges per district. We produce more than 10,000 doctors per year, 38 dental colleges, 60 nursing colleges. So we have become #1 state in India in terms of medical education. Apollo Hospital does a tremendous work in terms of educating thousands of people from India and also from abroad. Look at the schemes developed by government of Tamil Nadu. There are very, very innovative schemes like Makkalai Thedi Marthuvam, Innuyir Kappom, Nammai Kappom Thittam, Kalaignar Magalir Urumai Togai. There are so many things we can talk about. We have policymakers sitting in front of me, so they should be able to talk more about the government schemes rather than me. I think they know the numbers better than me. One of the most important thing what has happened in healthcare is usually government focus on large scale population coverage, primarily on communicable diseases. If you look at Tamil Nadu, until 15-20 years ago, we used to focus mainly on communicable disease. Now the shift has moved much towards non-communicable disease. I have shown the story of the child who has underwent liver transplant here. 15 years ago, even if you have crores in your pocket, we don't have the infrastructure or talent in our country or state to get a complex liver transplant surgery for a child. We have to go abroad. Things have completely reverted back. Even today, even in our hospitals, we get thousands of patients traveling to our state to get treated. That's the kind of shift has happened in healthcare. Look at what government has been doing. They have got multiple PET CT scans and LINAC radiotherapy machines installed in government hospitals. Actually, their services in many areas are much, much better than many of the private sector hospitals in our state. The kind of investment, technology, all these things are amazing. I wanted to really show something about what Apollo has contributed to the state, because unless otherwise we talk about Apollo's story, healthcare in Tamil Nadu will never get completed. Dr. Pratap Reddy returned back from US in late 1970s. In 1970s, he saw a young man died of heart attack. There was no cath lab in the country. He was not diagnosed properly. He was not treated properly. This patient died in front of Dr. Pratap Reddy's eyes. That day he decided he doesn't want any Indian at this age to die or any Indians to go abroad. So his vision was very simple. No Indian should travel abroad. They should get treated the highest possible care in our country. So he started the first hospital at Grims Road, a 150-bedded hospital. Now the hospital has grown into 70+ hospital. Dr. Pratap Reddy's vision has multiplied in the last 50 years, I would say, last 40 years. Now, countries, more than 170 countries are traveling to our country, including Apollo, to get treated. That's what we have done in healthcare in the last 50 years. Look at what Apollo has achieved in the last 50 years, 40 years. Since the first hospital, we have more than 76 hospitals, 10,000 beds, 16,000 nurses, 5,700 paramedics. There are so many pharmacies, diagnostic centers. We are able to provide complete spectrum of coverage. This is not an individual hospital story. This is the story of many firsts in India. Look at what we have achieved. First successful open heart surgery, first successful bone marrow, first successful liver transplant surgery, cadaveric kidney transplant surgery. Many, many firsts have happened in Chennai long back. Then many states are still falling behind. First, proton beam therapy. Look at the kind of investment what we are able to put in our state to bring in multiple patients from across the other states, also from other countries. Not only Apollo hospitals leading the healthcare in private sector, out of Chennai, there are many hospitals, including Coimbatore, Vellore, Madurai, Trichy. Christian Medical College has been providing highest possible of care for many decades, attracting patients from multiple other countries too. Even Trichy and Tirunelveli, Kaveri hospitals, PSG hospitals, KMCH, GEM, there are a number of hospitals. I can't list all the private hospitals, but number of hospitals are doing tremendous work to put Tamil Nadu in world's healthcare map at the top. The most important bit, what has been happening in our state is public-private partnership. Again, I'm quoting the story, what we have shown just now. A poor patient is able to get the highest possible treatment in a private hospital through CM scheme. That's a public-private partnership. Even private hospitals are able to go and operate in a government setup at free of cost as a social service. That's the kind of private-public partnership. Recently, Apollo Hospital has partnered with the government of Tamil Nadu through its CSR activity to support 2 dialysis centers. So government provides dedicated space, Apollo provides equipment, consumables, technicians, and quality oversight. This is the model which is needed for the future. Government has got enough infrastructure. Private sector can provide the talent, clinical insight, or whatever is required, and vice versa. This public-private partnership is the future for our state, and we have to nurture on. And in terms of transplant, I'm quoting transplant as one of the example because it's a very complex procedures. In India, only few states have achieved certain numbers. So we are very proud to say 1,500 solid organ transplant have happened in Apollo system itself. And the outcomes are amazing. We do more than 200 plus kidney transplant in Apollo network in Tamil Nadu itself. Organ donation, we have been the leader of organ donation for the last 2 decades, almost more than 15 years now. In 2008, we have launched the scheme. If you look at the statistics here, we have 5.4 donors per million population. This is 6 times more than the national average. National average is just a 0.86. It's only because of government's initiative which was started 15, 17 years back. And if you look at the number of donors generated, it's 546 donors generated, and we are the leaders in our state. Again, many private hospitals have contributed. This is a fantastic achievement happened in Jan 2026 because our state has generated 33 donors for organ donation. Out of this 33, 19 came from government hospitals. I'm sure it's a big moment for us to cheer. This is the effort of government to promote the government hospitals and private hospitals to promote organ donation. So Chennai has become Asia's healthcare destination. There are many numbers I just wanted to quote. 6.5 lakh medical tourists from India and abroad comes to Tamil Nadu, primarily to Chennai for getting treated. 14,400 crores of revenue has been generated through these verticals. 30 plus countries, more than 30 plus countries visit us quite regularly, and Sri Lanka, Bangladesh, Middle East, Africa, many more countries are coming here. I have some ideas on how we can even attract patients from developed countries. If we are able to achieve those things, we can attract more patients coming here. We are able to offer many treatments at 10% of the cost of any developed country. Again, I'm quoting some transplant cost. If it's a 1 crore in US, we are charging only 10 lakh rupees. And there are many high quality NABH and JCA accredited hospitals, and we have English speaking staff. Air connectivity, we have direct air connectivity, but that needs to be sorted because air connectivity to Chennai is dropping down significantly in the last few years. If we can focus on these things, I think we can still maintain very good data for the future. There are many gaps we can identify in terms of medical value travel. This is the way forward. If we can solve these problems with this solution, we have to establish a unified national MVT mission and launch a single window digital platform And we have to standardize pricing, patient experience, and quality so that the patients abroad might have trust on us. And we have to accredit and regulate MVT facilitators. And we have to strengthen global branding under one state narrative. Currently, each hospitals are going abroad to promote ourselves. I think state can help in promoting as a state. And even though we have achieved many things, there are few things still we have to finish. One is there is a huge disparity between rural and urban area. IMR in rural Tamil Nadu is 18 versus 8 in Chennai. And we have one specialist per 50,000 rural population versus one per 4,200 in Chennai. So these kind of gaps need to be addressed. The biggest challenge will be to create and retain good quality workforce in the healthcare. There will be a huge shortage of nursing in the future. We have to create more nursing college, we have to train more people, and we have to put efforts to retain them. Non-communicable disease burden is going to go up, and 2/3 of the deaths can happen because of non-communicable diseases. Prevention is the best way to reduce the burden, and our focus should be more on that. Digital health infrastructure is mandatory. Mental health needs more attention in the future. We have very less psychologists and psychiatrists. There is a stigma behind mental health. We have to break all these things to provide good quality, not only the physical health, also the mental health. And we have to invest a lot in terms of creating research and innovation ecosystem. So few suggestions from us for the future. So artificial intelligence and robotic technology can help us to reduce the gap in healthcare ecosystem. We have high clinical volume, good quality medical ecosystem, good quality research institute. But if we can integrate policy, academia, and industry, we should be able to move our vision from infrastructure to intelligence, volume to value, treatment to prevention, user to innovator. The way forward would be no family should stop coming to a hospital because of expense. Affordability and accessibility should get better. No rural patient should travel more than 200 kilometers for specialist care. No adolescent should suffer silently without access to mental health support. No citizen should feel healthcare is out of reach. If we can achieve this, I'm sure we can definitely go into a state for healthcare for all. Thank you so much.